Good morning, everyone. This is my informative speech. Today, I want to talk to you about something that affects millions worldwide but is often misunderstood, and this is addiction. Addiction does not discriminate. It affects people in all walks of life, yet it is often met with judgment and misunderstanding, as well as isolation. This stigma not only harms individuals battling addiction, but it also perpetuates the cycle of shame, and it prevents the person battling addiction from seeking help. Today, I hope to shed light on the realities of addiction and challenge some of the misconceptions that keep the stigma alive today. Let's talk about what addiction truly is. According to the National Institute of Drug Abuse, addiction is a chronic disease and it affects brain function as well as behavior. It's not simply a lack of will, as many people tend to believe. In fact, addiction changes the brain, especially in areas related to reward, stress, and self-control. These changes can make it very difficult for people who want to quit and truly want to actually do it. Think about other chronic diseases such as heart disease or diabetes. We don't blame the person for developing these conditions. Instead, we focus on treatment and recovery. Addiction should be looked in this same way. It's a disease that requires medical and psychological intervention. But unfortunately, this stigma makes it much more complicated. Now that we understand what addiction truly is, let's explore why it's still seen so differently from other diseases. Stigma, it has a powerful force. When we stigmatize addiction, we isolate those struggling with it. It creates an environment where people feel ashamed to seek help, often out of fear of being judged or looked down upon. The consequences can be tragic. Many people who suffer from addiction seek treatment don't seek treatment because of this, leading to preventable overdoses and deaths. Stigma is often rooted in very overdated beliefs. For instance, the idea that they simply chose this addiction or it is a moral, sinful nature is deeply embedded in our society. Historically, people with addiction were seen as weak and sinful, but we now know that that's not the case. Addiction has a complex psychological, biological, and social causes. It's not about being good or bad. So, how exactly does stigma show up in everyday life? Let's take a look. It manifests in our communities and even in our healthcare system. Stigma can be subtle, but it's pervasive. It can be as simple as using negative self-talk, like calling someone a junkie or saying they chose this addiction. These words may seem harmless, but they contribute to a community and an environment where people with addiction are dehumanized. Language does matter, and shifting our words is one of the first steps to breaking this stigma. Stigma also shows up in a way that society treats addiction differently from other illnesses or diseases. For example, people with cancer or other illnesses often receive sympathy and support, but someone battling addiction, they may face judgment or exclusion, even within the healthcare system. this stigma does still exist. Studies show that medical professionals can sometimes view patients battling addiction less favorably, which can lead to getting inadequate treatment and inadequate care. Now that we see how stigma operates on both a societal level and an individual level, let's turn our attention to how we can begin to break this and change it. Breaking the stigma surrounding addiction starts with education and empathy. As future healthcare professionals, community leaders, and advocates, we have the power to change how addiction is perceived by others. By educating ourselves and others about the realities of addiction as a disease, we create a more supportive environment, especially for those who are struggling. Additionally, listening to and sharing stories of recovery is very crucial. When we hear personal stories, we start to see the human side of addiction. These aren't bad people, not at all. They're individuals battling a very hard disease. And many of them do recover, and many of them go on to live happy and fulfilling lives. And I'm living proof of that. So, what can we do moving forward to help break this stigma? First, we need to change our language. When we use language discussing addiction, we need to avoid derogatory terms and use first person language like person with substance abuse disorder instead of saying they're an addict or a junkie. This can make a big difference in reducing that stigma. Second, we can advocate for policies that support recovery. Support systems like counseling, peer support, and healthcare access are essential for recovery. But many people don't have access to these resources due to mainly societal judgment. When we advocate for more accessible and compassionate care, we break the barriers for those in need. Finally, encourage open conversations about addiction. The more we talk about it, the less that it has power. Be willing to challenge the stereotypes and educate those around you about the realities of what addiction truly is. I want to close with this. Addiction is a disease, not a moral failure. The stigma surrounding addiction not only harms individuals, but it weakens our communities. It's time to change the conversation. I'll leave you with this. Just think about this. What would our world look like if we met addiction without judgment and we met addiction with understanding, compassion, and support? What kind of change could we create if we viewed addiction as a disease instead of a personal flaw? Thank you for your time.